Assalamu alaikum. Continuation of the gram-negative enterics takes us to Salmonella. This is a species that causes the main disease that it causes is called typhoid fever. بالعربي بنسميه typhoid. So typhoid fever, and then the second thing would be septicemia, as is common with the gram-negative enterics, with if they can reach the systemic circulation. And then there are metastatic infections, meaning it is outside their natural area, which is one such example would be osteomyelitis. Now, they are one of the most common causes of bacterial enterocolitis. We know that they do not ferment lactose, and they do not produce H2S, as we saw with the previous with lecture 1. They have antigens, cell wall antigens O, flagellar, they are motile, and then capsular VI for virulence, and they are all important for its taxonomic and epidemiologic purposes. هلا ال O antigen outer polysaccharides of the cell wall هدول احنا بنستخدمهم to subdivide Salmonella into different groups, groups A to I, and there are two forms for the H antigens, واحد واثنين. One of the two H proteins is synthesized at any one time, so you will not have both H proteins together. Depending on which gene is ذكروا حكينا in the genetics on which gene sequence is in the alignment for the transcription of the mRNA. As for the VI antigens, they are antiphagocytic and are an important virulence factor for Salmonella typhi, which causes typhoid fever. So you need this VI antigen to survive in order for it to cause typhoid fever. If it wants to cause fever, that means إنه في شو صار. If there's fever, then there has to be invasion into the systemic circulation. That means you need something to improve your ability to survive leukocytes that are present in the blood, and VI antigen is the main thing that we use. So if you want to really remember one of these, you have to remember the VI antigen. You use it as an important virulence factor, and we use it here. It is important for serotyping. Serotyping, this is what we do in the lab to serotype Salmonella typhi. So هلا السالمونيلا لهم كتير أشياء أنواع. So Ewing divides this genus into 3 species: Salmonella typhi, Colerasius, and Salmonella enteritidis. هلا Colerasius و enteritidis depends on in other formulations they call them different names. In this schemes, there's only one serotype for each of the species of the first two, and for the enteritidis 1500 serotypes. طلعوا في غيرهم this Kaufman and White, which assign different species name to each of the serotypes. There are roughly 1500 different species, عادة, in which city they have been discovered. The third approach is according to DNA hybridization. شو يعني إنه we break apart the DNA and then we see which DNA resembles what. So اللي قراب على بعض هدول بنسميهم distinct species, واللي بعاد كثير عن بعض الدايجيشن تبعهم مختلف شكله بنحطهم in another species. All of which are in use. Okay, so Salmonella are in two different categories: those that cause typhoid, بنسميهم هدول the typhoid causing species, and those that cause diarrhea اللي هو enterocolitis and metastatic infection. So the typhoid species بنسميهم Salmonella typhi and paratyphi. These are two of the species that cause typhoid fever. The others that cause enterocolitis and metastatic infection عادة بنسميهم the serotypes of Salmonella enterica. So that's what you need to know: typhi, paratyphi, typhoid. Salmonella enterica causes non-typhoidal. It's non-typhoidal and causes عادة enterocolitis. من الاسم enterica, enterocolitis, typhi, typhoid. Okay, so enterocolitis is an invasion of the epithelium and the subepithelial tissue of the small and the large intestine. Tamam. So we know, يعني as this is for enterocolitis. So salmonella does what do we know that happens in the gut that prevents the invasion of مثلا bacteria in the gut, especially in the colon. We know we have the Th17 immune system, and this recruits neutrophils to limit the infection. So this is the your main mechanism of defense against this. So neutrophils will limit this infection to the gut and adjacent mesenteric lymph nodes, and bacteremia is not very frequent in this case. Gastric acid is an important host defense. So people with loss مثلا ما عندهم gastric tissue lost their ability to or have used a lot of antacids will make it less easy or easier for the bacteria to invade. So if you don't have neutrophils, you will be more susceptible to this, or if you don't have gastric acid, you will be more susceptible to salmonella enterocolitis. Now, typhoid and other enteric fevers, the organism here enters and multiplies in Peyer's patches, and we know that Peyer's patches are present in the gut. They're not go- there are the عادة present in the colon, and they enter there, and we is a ذكر من pathology. It's these patches are filled with lymphocytes. So these organisms will multiply in the mononuclear phagocytes of these lymph tissues. And then they will spread to the phagocytes of the liver, the gallbladder, and the spleen. It predilects to the gallbladder. It can even, we will see that salmonella may even become endemic. It becomes may colonize the gallbladder. Okay, so as they go through the phagocytes of different organs outside the gut, this is their entryway into the blood, and this causes bacteremia. And as we know, إذا في عندك gram negative موجودة بالبلد, this will cause some of its destruction, and that will release LPS, and obviously that will be associated with fever. So, is it a direct invasion? In a sense, yes, it does invade all the way to the Peyer's patches. The Peyer's patches are below the mucosa. They're not in the mucosa, and they're not as far as the serosa, but قبل شوية. So they do invade, but they do not invade directly into the blood. They are carried away with the phagocytes. So it likes phagocytes and survives and proliferates within them. That means they have to stop the pathogen, or often they have to stop the phagocyte from doing the oxidative burst on them. So they prevent the cytoskeletal movement of the vesicles that engulfs them, and then they stop them from being fused with lysozymes. So lysosomes عفوا, and they will not destroy them. So they will stay there in these vesicles, and they keep growing, and that's its main characteristic. And then it's very important that it likes to invade the gallbladder. تعرف the gallbladder keeps secreting bile into the and bile doesn't really affect the gram negative, so it will keep being secreted with the bile, and then that will cause a carrier state in the gallbladder and keeps shedding in the stool for a very long time. So these two important characteristics of this typhoid and the other enteric fevers. Now for septicemia, accounts for about less than 10%. Usually in patients with underlying chronic disease, مثلا sickle cell anemia, cancer. Tamam. We know cancer reduced immune system. We know sickle cell anemia. They can have autosplenectomy. We know children with enterocolitis as well may be susceptible. So bacteremia results in the seeding of many organs. Osteomyelitis, meningitis, pneumonia are common areas that may be affected. So from our table here we have salmonella, except typhi, and then typhi alone. What is the reservoir? As these are the feature is what is the reservoir. كتير مهم نعرف. This comes up very frequently on exams. إنه Salmonella typhi, the default Salmonella, and the default Shigella are the reservoirs as humans. The other Salmonella, the main reservoirs is poultry and eggs. بيض ودجاج. Poultry and eggs, very important. بيحكي لك مثلا بالمطابخ شو السيناريو بيجي بامتحانات عادة بالمطابخ. واحد كان he was handling poultry يعني ايش مثلا he is cooking raw chicken, he's handling raw chicken ما غسل ايديه. That's one common thing. Or a factory worker, things that have to do with raw chicken and raw eggs. Very important, comes in many questions. نعرف انه Shigella has the lowest infectious dose, Salmonella has higher infectious dose. Diarrhea as a prominent feature. What is it going to? It's not a feature of Salmonella typhi or typhoid, but it is for the enteric one. So obviously this is a problem for the others as well. Who invades the bloodstream? Salmonella invades the bloodstream. So we know this through indirect mechanisms. They do go invade the bloodstream. They can cause septicemia. It is not the case for Shigella. Chronic carrier state, لمين? Salmonella typhi. وين? بالgallbladder. Other Salmonella, do they cause this? Yes, not as frequently though. Lactose fermentation, نعرف انهم كلهم no. H2S اللي Salmonella is positive. And vaccine. Okay, where were we? Okay, so H2S production, we know that is lactose nut fermenter and a lactose and a H2S producer. We know this. And then vaccine for Salmonella typhi, there is a vaccine, but not for the other types of Salmonella. Okay, so the epidemiology of these infections is related to the ingestion of food and water contaminated by waste. So S typhi is the cause of typhoid fever, transmitted only by humans. The most frequent animal source حكينا is poultry and eggs. Some pets can transmit, especially dogs. What are the findings? شو بتشوف عند المريض following an incubation period عادة 12 at the earliest, 48 at the latest. What is this number? عادة is the time for بما إنه is ingested, so the time for it to reach the colon basically. So it depends on that person and how quick that is for them. So symptoms of the enterocolitis may happen. عادة is usually nausea and vomiting, then progresses to pain and diarrhea, which can vary from mild to severe, usually without blood. This is for the enterocolitis variant. Usually the disease lasts a few days. It will go away on its own. People who have low CD4 count with HIV, people have much greater number of Salmonella infections. مين يحكي لي why? You would realize حكينا تذكروا إنه the Th17 CD4 cells are the most affected in HIV. So that tells you how important the Th17 CD4 is important for controlling Salmonella infections. تمام. Typhoid fever. بالنسبة للtyphoid fever, this is a slow onset of gradual fever and constipation, and does not really begin with diarrhea. So there's no diarrhea at the beginning. So once you have the fever, it usually comes with a constipation. There may be diarrhea before, so before the bacteremia occurs. At the first week, the bacteremia becomes sustained. High fever, delirium, tender abdomen, and enlarged spleen. So what you are seeing is lots of invasion of this gut bacteria into the blood. That's what you're seeing. So it's really a fever disease, not really a gastrointestinal disease. So rarely rose spots هاي شكلهم these come up on the skin in people who are in the symptomatic phase of typhoid. So, and then leukopenia and anemia are often seen, and that is usually begins with the enlarged spleen. As the spleen is affected, that's the main or the first time or the first sequence before this you get into leukopenia and anemia. Liver function tests are also abnormal, indicating that the liver might be also involved. Lab test, we know it's an H2S producer, so it's going to give you the black color on the it's not a lactose fermenter, so ما راح يكون عندك acid at all, so it's going to be red with black on it. And so red slant, the yellow bar for the glucose you will not see, as it will be covered by H2S, and there will be gas production. Enterocolitis, if you want to diagnose it, just تاخد sample, stool sample, and then we can run it, and then you'll get this variant. Typhoid fever, you need to do blood culture. This is important. You're not going to do a stool sample. You're going to do a blood culture during especially the symptomatic phase in the first 2 weeks of illness. Bone marrow cultures are often positive. ذكر حكينا they can invade. If once they start invading the spleen, then that's the next step for them is to start at the bone marrow, and that's how osteomyelitis may also become positive for patients with typhoid fever. This is the metastatic infections that we mentioned, but the bone marrow infection, that is the main reason for the reduced white blood cells. Okay, so salmonella form and non-lactose colonies, we know this. On TSI حكيناها. Staph is the major exception. It does not form gas and produces only a small amount of H2S. تمام. If the organism is urease negative, it is this protease organism which can produce a similar reaction on TSI are urease positive. So that's how you differentiate protease on يعني انت ما تطلع على السوارمينج، تطلع جوا التيوب. So the way you can differentiate them عادة is by urease between salmonella and protease. Treatment enterocolitis usually self-limited. شو حكينا أي شيء بالdiarrheal disease, fluid and electrolyte replacement. Antibiotic treatment does not shorten the illness or reduce the symptoms and may even increase the carrier state and antimicrobial resistance. So we do not give antimicrobial treatment in this case. Now, enteric fever, typhoid fever, yes, you need to give antimicrobials. This is the only way for you to treat it. So you can give it fluoroquinolone or third generation cephalosporin, especially ceftriaxone. Now, somebody who may have become a carrier, their gallbladder, you may need to remove the gallbladder, but before that you have the chance. حكينا cipro fluoroquinolones have high invasion in tissues, so this is one of the tissues that cipro can accumulate in and can kill the bacteria. So either ampicillin or ciprofloxacin can help reduce or remove carrier states. The final option would be to remove the gallbladder. Prevention. Sewage treatment احنا حكينا انه comes from the الأول إنه عن طريق ال stool or feces that may be contaminating food or water. So we need to have proper sewage treatment for water and proper food handling techniques. So hygiene measures, hand washing, pasteurization of milk, clean and aseptic techniques أحيانا بكون أحسن, and then proper handling of food, especially poultry and eggs. Vaccines are present, but they give only partial resistance to the disease. Okay, so now pathogens that are primarily within the enteric tract هذولا mainly cause gut infections. الأولى بنحكي عنها هي الشيجيلا, which we covered a good deal of when we were talking about salmonella. So Shigella species cause enterocolitis, which is often called bacillary dysentery. هلا dysentery, dysenteria بسموها بالعربي, is bloody diarrhea. That's mainly what it is. So Shigella are نعرف انهم non-lactose fermenters. They do not produce H2S. They are gram-negative rods. And then there's no cas fermented from the fermentation of glucose, so they will have an acid butt, a red slant, no H2S, and they are non-motile. هذا طبعا بيختلف عن السالمونيلا. حكينا السالمونيلا عندها H antigen, which means they are motile. تمام. All Shigella have O antigen, who polysaccharide, in their cell wall, and these antigens are used to divide the genus into 4 groups. اوكي, pathogenesis and epidemiology. حكينا نقطة كتير مهمة كانت انه Shigella has the lowest infectious dose. As little as 50 or 100 bacteria can cause disease. This is very very little. So they can, معناته ايش? They can resist the stomach acid, and they can invade to the gut through بما انه it's primarily in the gut, معناته شو من بدها تدخل؟ اكيد من through the mouth, so through food. So that means it needs to survive the 2 main mechanisms that you have in your gut, اللي هم acid and bile. So it can resist both, obviously, and can progress into the gut. Shigellosis, it's only a human disease, as there is no animal reservoir. So here is a mnemonic about the 4 F's. Fingers, flies, food, and feces are the principal factors for the transmission of Shigella. Transmission, obviously حكينا, is fecal-oral. It's a foodborne outbreak, so outnumbers waterborne outbreaks by 2 to 1. Why? Because you need to ingest a large amount of water in, and يعني المية شو بتعمل مية it usually dilutes things, right? So you need to drink a lot of water that is contaminated for you to accumulate enough infectious dose to cause disease. بس الفود does not dilute. يعني if the food is contaminated, عادة will have a significant amount of bacteria. So that's why food outbreaks عادة أكتر من waterborne outbreaks. So this is usually a food-borne outbreak. بعكس مثلا Vibrio cholera usually is a water-borne outbreak. The outbreak here occurs in مثلا daycare nurseries, mental hospitals, children, ناس who have mental problems. عادة they are less likely to have مثلا impeccable hygiene, right? So they're more likely to have مثلا older people, younger people, people with mental problems. هذول مثلا عادة in all in the same area مع بعض. Hospitals, nurseries. This is a common area for outbreaks. There is no prolonged carrier state زي salmonella. Bloody diarrhea is produced due to invasion of mucosa. ذكروا حكينا Shiga toxin. This comes from Shigella, the Shiga-like toxin that the enterohemorrhagic E. coli gets. So this is the origin of the toxin. What are the findings? So incubation periods of about 4 days or less. عادة 1 day to 2 days. شو بصير معهم؟ fever, حرارة, معناته إيش فيه؟ invasion. Abdominal cramps. عفوا. So yeah, fever, and then that will be followed with abdominal cramps. The cramps is usually due to the accumulation of fluids and bacteria in the gut. There's dysbiosis as well. كل هذا. And then there's contractions that causes the cramps. This will be followed by, as it accumulates, it will be followed by diarrhea. بما إنه في invasion, and there's a lot of secretions, so you'll have bloody secretory mucus diarrhea with fever. This picture is called dysentery. Shigella, which causes almost exclusively only in the gastrointestinal tract, produces bloody diarrhea by invading cells of the distal ileum and the colon. So عادة الججنم is usually the jejunum, the majority of the early ileum is not, ما بنقدر نحكي sterile, but doesn't have bacteria usually. It's مثلا jejunum بسموه بالعربي الصائم, because it's usually, if when you do dissection you don't see anything in it because of the quickness of the movement of water and fluids through it. But the colon عادة distal ileum هون وين الأشياء تتجمع وبتاخذ وقت and becomes fermented. هنا عادة maldiarrheal disease strikes. So local inflammation accompanied by ulceration occurs, but the organisms rarely penetrate through the wall or enter the bloodstream, unlike Salmonella, so they do not penetrate beyond the mucosa. Although some strains produce enterotoxin هما الشيجا toxin زي ما حكينا موجود بالإيهاك, the invasion is the critical factor in pathogenesis, whereas E. coli is better equipped to use and damage the body with the Shiga toxins than Shigella. يعني ال E. coli مع انها بتاخذ الشيجا toxin, E. coli بتستخدمه أحسن من Shigella. Shigella doesn't really utilize this toxin. The evidence of this is that mutants that fail to produce enterotoxin but are invasive can still cause disease. معناته Shigella toxin in Shigella, Shiga toxin in Shigella is not necessary for dysentery. مهم كتير هاي النقطة. How does the Shiga toxin, بما أنه toxin حكينا, يعني you would be remiss not to always say bacteriophages. So it's a lysogenic phage that infects both Shigella and E. coli, and that's how it transmits into both. حكينا إنه this EHEC can cause enterocolitis, and then with the use of Shiga toxin they can cause hemolytic uremic syndrome. تمام. What are the findings of the clinical findings? عادة you can trace back the food that has caused the disease in مثلا about 1 to 4 days. مثلا بتسأل what different food. عادة شو بتسأل؟ بتسأل شو إشي غريب أكلته. ليش تسأل هيك؟ لأنك أنت بحياتك قاعد تاكل. Usually you have, يعني بالشكل الطبيعي usually you have the same hygiene issue. ما عندك مثلا دائما you always use the same hygiene, you are always using the same cooking, you are always using, so you're always in a safety net. ليش تسأل إيش أكلت إشي غريب؟ when have you ventured outside this safety net اللي أنت دائما عايش فيها؟ مثلا أكلت مطعم مختلف, جبت أكل مختلف حاولت تطبخه بالبيت, something like that, something new that you have used, or some raw material you have never used. This is how you usually on the issue. عادة, so you get to this, symptoms will begin زي ما حكينا, fever and abdominal cramps, diarrhea, watery at first, and then we'll have more and more invasion, more and more blood and mucus will be secreted. The disease varies from mild to severe. What differentiates the two is what species of Shigella and the age of the patient. So younger and elderly are more severely affected. Shigella dysentery, which causes the most severe disease, usually seen in the US with people that are coming back from other countries. Whereas إحنا عنا really أكثر شيء مثلا بيجوا ناس مثلا من مصر, من السودان, ممكن هدول ممكن يعني نشوفها عندهم ذات بالنسبة لنا يعني. Shigella ثاني بنشوفها عندنا هون إحنا كتير, and this also causes mild disease, and this is the same for us as the states, إنه إحنا بنشوفها with mild shigellosis. The diarrhea frequently resolves in about 2 to 3 days. In severe cases, antibiotics here they can shorten the course. If there is invasion, there is blood involvement, so antibiotics will definitely improve the course. زي ما قاعدة بتحكي مثلا على typhoid. So serum agglutinins appear مثلا after recovery but are not protective because the organism does not enter the blood. Here the role of the IgA in the intestine is still uncertain. Lab diagnosis حكينا, so بما انها enterobacteriaceae, it will utilize glucose but not lactose, ما في H2S, ما في gas. Shigella from non-lactose fermenting colorless colonies on McConkey or EMB agar obviously. حكينا ال TSI, conformation of the organism as Shigella. We can do a slide agglutination test. Treatment, obviously you have to do, this is diarrheal disease, بدك تعمل fluid and electrolyte replacement. mild case ما بتعطي antimicrobials، وعادة يعني you don't worry because usually the red flag اللي هو presence of blood ما بيكون كتير موجود. هلا severe cases شو بدك تعطي؟ ممكن تعطي fluoroquinolones or sulfatry as an alternative choice. It's very important. Antiperistaltic drugs are contraindicated because they will prolong the fever, the diarrhea, and the excretion of the organism. It's very important that you cannot use any antiperistaltic drug. Prevention, زي ما حكينا بالtable, this is similar to what we saw in salmonella. There's no vaccine. هلا cholera, Vibrio cholera is the cause of cholera. وفي عندنا Vibrio parahemolyticus, which causes diarrheal disease associated with eating raw or improperly cooked seafood. And then في عندنا اسمها Vibrio vulnificus, which causes cellulitis and sepsis. هلا هاي اللي نحكيها هون هي Vibrio cholera. The type of pathogenesis, this is very important. Cholera is one of is probably it's unique in حكينا مين عندهم كان toxins. شيجيلا عندها toxin بس ما تستخدمه. EHEC تستخدم التوكسين شيجا toxin, and the one that is other one اللي هي تستخدم toxin in a very prominent manner of those that cause of the gram-negative gut bacteria هي cholera. So it is toxigenic. هلا بنحكي كيف. So it's usually watery diarrhea produced by a toxin. The site of infection is the small intestine. شو حكينا احنا قبل شوية؟ حكينا the majority of bacteria are in the gut, in the colon, and usually the small intestine is not a typical site for infection. That makes cholera a very unique way of causing infection. The main approach to the therapy, obviously this is water diarrhea, fluid replacement. دائما أي شيء بيجي water diarrhea, fluid replacement, and then you start to think, should I or should I not use antimicrobials. هلا بما إنه بنحكي عن بقية هدول تنتين لقدام. So this is the picture of Vibrio cholera from the beginning of the lecture. We saw a curved rod with a prominent flagella. Okay, so it is transmitted by شو قصة الكوليرا بأي مكان contaminated water sources، الناس ما عندها حمامات. هاي هي قصة الكوليرا. فأنت إيش فكر فيها؟ فكر مثلا عشان تكون عندك صورة بمخك عن كوليرا. مثلا دولة إفريقية ما عندهم مية، عايشين بالصحراء. مثلا دول إفريقية بتشوفوها مثلا على التلفزيون. They have really less access to water. ما عندهم مثلا الفاسيلتيز اللي موجوده على عاده مثلا more advanced countries. ما عندهم مثلا الحمامات والسوج system. So there is a very prominent مش مره وراحت continuous contamination of this short few water supply. فيعني you can realize how important cholera is as a determinant of the water health of a country. فمثلا كانت بالزمانات لما اكتشفوها الكوليرا كانت موجودة كانت prominent in Egypt at that time. وإيجيبت بال 1800 أو هيك تقريبا. It had شو مثلا عندك يعني the same thing, it's a farming community واستخدموا مية، ومثلا في كتير مية راكدة بهاي المناطق، وممكن الناس بيستخدموا هاي المية للأكل للطبخ وللشرب. And then you won't have the proper sewage and facilities to contain waste. So there's a contamination here between the two. The animal reservoir are marine shellfish, مثلا shrimp and oysters. The factors that predispose to epidemics اللي هم بحكينا poor sanitation, overcrowding. ناس كتير بهالمية ما عندهم مدخل لمية نظيفة. they're not really they're malnourished, they're not really well nourished, and then there's poor sanitation. ما فيش شيء مثلا حكينا مثلا sewage system and facilities to use for waste disposal. So and then you have inadequate medical service. ايش مثلا صار معه دايريه وصار معه مشكله، هل بتقدر تعطيه فلويدز؟ في عندك مثلا مستوصف تعطيه فلويدز؟ في عندك enough fluids؟ That's the problem, the second problem with cholera. So no access to good water produces water diarrhea. You need water fluids to treat it, and the main reservoir is in water creatures, so it's a water problem, the cholera. Important properties: a curved comma shape, gram-negative rods. It's not part of the enterobacteriaceae. Cholera is divided into two groups according to the nature of the O cell antigen. The O1 group causes epidemics, whereas the non-O1 organisms cause sporadic and are non-pathogenic. The O1 organisms have two biotypes. There's classic and ILTOR. The three serotypes هدول أسماء Ogawa, Hikoshima, and Inaba. These are based on the different biochemical reactions. You don't need to know them. We're just mentioning them. These features are used to characterize هدول for epidemiologic investigations. عشان ليش إحنا بنعرف هذا؟ مثلا إذا في عندي أنا epidemic بدي أعرف مثلا is it one pathogen or non-pathogen, which one of the O group أي واحدة عشان أنا so I can trace its origin. Okay. So pathogenesis and epidemiology. Vibrio cholera is transmitted by fecal contamination of water and food, primarily from human sources. Human carriers are frequently asymptomatic and include individuals who are either in the incubation period or convalescing. شو يعني بصير؟ Patient who has the problem defecates. He doesn't have diarrhea or has mild diarrhea. Defecates. This feces will reach the water supply, and then another person will drink it, and then they will have it, and then they will defecate some more. It's a circle that keeps continuously increasing the problem in the water supply. Since the main animal reservoir is marine shellfish, ingestion of this without adequate cooking can transmit the disease. شو يعني؟ يعني من وين بدها تيجيهم؟ Usually from inadequate cooking of this shellfish, and then you are in an area with poor water supply, poor sanitation, poor كل هالأشياء. This is the recipe for causing an epidemic. صار هلا في قصة بدي أحكي لكم إياها. I don't know if it was mentioned to you how Vibrio cholera was first discussed or first described. So it was described by a German scientist who يعني شاف المي شاف راح على مصر بال 1800 وشاف القصة وحكى it has to be in the water. فجاب معه شوي من مية النيل وراح على ألمانيا وصار يوجههم هذا وحكى this is definitely where the organism موجود. فكان له زميله he was not believing him. He said it's definitely not. So I will prove it. He drank the water. ما صار معه ولا إشي. So شو هذا بحكي لك؟ بحكي لك you have to continuously drink the water. You have to continue because you have to have حكينا water based outbreaks. You need to be مش تشرب شوية هيك مية، بدك ضلك تشرب منها على طول. هذه النقطة الأولى. النقطة الثانية إنه stomach acid can proper stomach acid will neutralize the Vibrio cholera bacterium. Plus بيحكي لك إنه كمان هذا زميله كان he had probably gastrinoma or something where he had a lot of production of stomach acid, so that's why he didn't get it. And هذه السبات between the two has يعني أخر التعرف على الكوليرا for a while. So what the last epidemic that we have in the 60s and 70s in Southeast Asia and spread to Africa, Europe, and the rest of Asia. Another pandemic began in Peru and spread to Central and South America. هذا شو هاي صورة الكوليرا. So poor access to water supply، ما في مية نظيفة، يعني يعني بجوز الآية أصبح ماءكم غورا فمن يأتيكم بماء معين. If you don't have water، وين بدك تجيب المية؟ شو بدك تساوي؟ If you don't drink it يعني قديش واحد بيقدر يعيش بدون مية. if you recall يعني the most without water يعني maybe 2 to 3 days 3 days at most. فانت يعني انت بهاي الطريقة انت مضطر there's nothing to do. فمن الاشياء بجوز انت شفتوا مثلا فيديوهات ال WHO انه كيف مثلا اذا انت if you are forced to drink this kind of water كيف انك مثلا تستخدمها، كيف انك تنظفها، كيف انك مثلا تحاول تنقيها بطريقة او باخرى. هلا ما هي زي هيك مية راكدة ما في غيرها. it's very easy كل الناس بيستخدموها it's overcrowded ف it's very easily to be contaminated. This is the picture of cholera. مش ضروري افريقيا، ايجا كتير بتصير بايجا، خاصة مثلا بنغلاديش كتير بتصير عندهم. انديا مثلا very very common in this kind of situation ما فيش مية نظيفة. بس عادة انديا فيها مي أكتر من هذا so there's no مثلا إنه هو مثلا نقص بالماء هو النقطة المهمة الثانية. Okay, so the pathogenesis is an enterotoxin mediated vibrio toxin very very important. النقطة الأولى very very important. النقطة الثانية it affects the small intestine. نقطة كتير مهمة كمان. So large numbers of bacteria must be ingested because the organism is particularly sensitive to stomach acid. So if you are taking antacids بتروح على تشرب هاي المية obviously that makes your infectious dose طبعا كتير أقل راح تصير. The toxin has زي كتير من toxins an AB configuration binding and active وال A part causes ADP ribosylation cyclic AMP زي حكينا تذكروا حكينا مثلا بالpertussis how you get this diarrhea like illness نفس الميكانيزم تبع الدايرية بس in the lung lots of water. This is the other one. This is the actual one. This is cyclic AMP ADP ribosylation. A huge gushing of fluids into the lumen from the area where lots of water is present اللي هي surface area كتير كبيرة اللي هي ايش؟ the small intestine. So severe very severe watery diarrhea rice water stool هذه كلمة كتير مهمة rice water stool no blood no neutrophils no mucus but very large volume of severe watery rice water diarrhea. هذا شو بصير؟ انت بتخسر كثير المية شو راح تخسر معاها؟ So you're losing bicarbonate so you are prone to acidosis. You're going to lose a lot of potassium so you have hypokalemia. So the mortality rate without treatment is about 40%. هذا رقم يعني مهول 40% تقريبا نص الناس راح يموتوا if you do not treat them. So if treatment is instituted promptly the disease is self-limited to about 7 days. Toxin is transmitted by lysogenic conversion of other vibrio as well. The pathogenesis is dependent on the colonization of the small intestine by the organism and then secretion of the enterotoxin. So for colonization to occur, since a large number of bacteria must be ingested, patients with little or no stomach acid or people that are taking antacids or have gastrectomy are much more prone and susceptible. Adherence to the cells of the brush border is required for colonization, and then this is done by the secretion of the bacterial enzyme called mycinase, which dissolves the mucus and then sits in the dissolved area. After adhering, the organism multiplies and secretes an enterotoxin هو بسموه cholera toxin, which can reproduce this. يعني إذا بتعطي الواحد الكوليرا توكسين لحاله بتشربه كوليرا توكسين رح يصير معه watery diarrhea as well. So enterotoxin can reproduce the symptoms of cholera even in the absence of the vibrio organisms. هل في invasion في الميكوزا؟ No. So A and B حكيناها ribose to the G proteins. So this locks the G proteins in the on position, which causes persistent stimulation of adenylate cyclase and the continuous overproduction of cyclic AMP, which activates these different protein kinases, which results in the loss of water and ions from the cell. The genes for the cholera toxin and other virulence factors are carried on single-strand DNA bacteriophage called CTX. This lysogenic conversion of non-toxin producing strains can occur when the CTX phage transduces these genes طبعا. The pili that attach the organism to the gut mucosa are receptors for the phage. تمام. none o 1 اللي هم بيعمل sporadic disease are associated with eating shellfish مثلا obtained from coastal waters وبصير مثلا معهم كوليرا وبكون يعني ما بتكون outbreak كبير. Water diarrhea, large volumes is the hallmark of cholera. No red blood cells طبعا, no white blood cells, no mucus. Rice water stool applied to non-bloody effluent. There is no abdominal pain and subsequent symptoms are referable to the marked dehydration. كله هذا acidosis with hypokalemia. That's what you're looking for, the problem that can cause مثلا heart and renal problems. تمام. During epidemic clinically no lab is needed. مثلا في عندك epidemic ما مش ضروري تقعد تشخص كل واحدة فيهم. خلاص you know you have an مثلا epidemic or an outbreak, so you just keep treating people who come with diarrheal disease على أساس إنهم عندهم cholera. إذا ما عندك outbreak and you want to know, you have selective media which you can use to isolate it. Cholera will show colorless colonies obviously on McConkey because lactose is fermented slowly. بس تذكروا من organisms in PVNCH. C كانت cholera and Campylobacter. So these are oxidase positive organisms. On TSI agar, an acid slant and an acid butt without gas or H2S are seen, and because the organism ferments sucrose as well. So presumptive diagnosis of cholera can be confirmed by agglutination, مثلا polyvalent O1 or non-O1 is antiserum. Treatment, obviously replacement of water and electrolytes. Glucose you can add it to enhance the uptake of water and electrolytes. Antibiotics مثلا التتراسايكلين, واحد ممكن يفكر إن التتراسايكلين and this is a curved organism مثلا whatever, but it does not really help. Prevention, ما في إشي تسويه إلا to stop the outbreak is to provide people with clean water. If they عندهم clean water, clean sanitation, توقف انت outbreak, and then you can treat the remainder of the people. هلا as prevention إذا بدك تعطي tetracycline for close contacts, مثلا close contact, this is effective, but will not prevent the spread of a major epidemic. لأن المشكلة مش close contacts, it's not مثلا زي مثلا COVID close contacts, it's the water and the sanitation is the problem. Prompt detection of carriers is important for limiting outbreaks as well. Vibrio parahemolyticus. This is it is a major cause of diarrhea in Japan. ليش Japan? Because Japan they eat a lot of undercooked or raw seafood. So they eat raw fish is eaten in large quantities. عندهم Vibrio parahemolyticus is a major problem of diarrhea. So it's a marine organism transmitted by ingestion of raw undercooked seafood, especially oysters. اللي بيعرف الاويسترز عادة الاويسترز مثلا بتركيا الاشياء القريبة علينا تركيا مثلا ما بعرف وين كمان دول تانية بيبيعوها بالشارع مثلا بفتح لك اياها and then بحطك عليها ليمون بتاكلها زي ما هي. So that's obviously not cooked or undercooked. Sometimes بيبيعوها مغلية مثلا وبفتح لك اياها. Sometimes بيبيعوها uncooked. So it is a major cause of diarrhea, especially مثلا in Japan like we mentioned. It is infrequent in the United States. للامتحانات بيسألوا عن شو الستوري بيكونوا مثلا ناس in a cruise ship. كلهم cruise ship and they all have an outbreak. This is one possible outcome. Little is known about the pathogenesis except that it is an enterotoxin mediated illness much like Vibrio cholera. Clinical pictures varies from mild to quite severe watery diarrhea, nausea, vomiting, abdominal cramps, and fever. Was that a problem with the previous cholera, the regular cholera? No, it's not a problem, but here it is a problem. So it can present as a symptom. Yani. The illness is self-limited, lasts about 3 days. It is distinguished from cholera mainly by the basis of growth in sodium chloride. So مين إذا تفكر فيه مين the marine organism obviously will grow in 8% NaCl, not cholera, which lives in fresh water. So that's how you can detect the two. No specific treatment is indicated because the disease is relatively mild and self-limited. Disease can be prevented by proper refrigeration and cooking of seafood. هلا Vibrio vulnificus is a marine organism as well. It causes severe skin problems. This is a cellulitis. So it causes skin in people that handle shellfish and they have sustained عندهم مثلا بيستخدم الشلفش مثلا شو بيكونوا منظفوا فيهم عادة اللي هم الشريمب مثلا whatever بيستخدم سكينة ممكن يجرح حاله he keeps going. So هاي الجروح على ايده it might become a breeding ground for this infection. So it can cause severe infection, cellulitis in this kind of case. It can, in people who are immunocompromised, it can be very rapid and fatal septicemia in their cases. Hemorrhagic bullying in the skin often occurs in patients with sepsis caused by this organism. Chronic liver disease predisposes to severe infection and is not a sequel. Treatment لشو Vibrio. So here where doxycycline is really يعني useful. تمام. Campylobacter. Campylobacter jejuni إذا بتذكروا قبل فترة بالصيف صار في عندنا بالأردن حالات diarrhea and a few people died. One of the main organisms that caused this was Campylobacter. كان في Campylobacter وكان في I think Clostridium or Bacillus, I think Bacillus cereus, Campylobacter وكان في كمان واحدة ثالثة I don't recall the third one. But Campylobacter is a very common problem. So Campylobacter is a frequent cause of enterocolitis, especially in children. Is a common antecedent to Guillain-Barré syndrome. إذا بتعرفوها, this is a demyelinating neural disease. So عادة people have diarrhea and then they have Guillain-Barré. Campylobacter is one of the organisms implicated in as an antecedent for Guillain-Barré. Other Campylobacter species are rare, but jejuni is the most common one. كنا بنحكي طبعا this is obviously an oxidase positive one حكيناها تمام. Okay, properties: curved gram-negative rods that appear either comma shaped or S-shaped. حكيناها ببداية المحاضرة الأولى إنه in our the figure that showed how do you see the organism. This microapheric grows best at 5%. Growth at 42. This is يعني hallmark of Campylobacter. Growth at 42, extremely important امتحانات. Whereas Campylobacter intestinalis does not grow in this temperature. This is important for microbiologic diagnosis. So domestic animals, cattle, chicken, dogs are a source of the organism. The transmission is fecal-oral. معناته اللي صار عندنا إحنا شو اللي مثلا صارت بالchicken كان شاورما. So obviously it has been contaminated by fecal-oral. Something has been contaminated. This is a problem. Food and water contaminated with animal feces are a major source of human infection. Foods such as poultry, meat, and pasteurized milk are commonly involved. فمعناته كانوا بيستخدموا عادة مثلا بالنسبة اللي صار عندنا مثلا definitely meat, poultry that was not cleaned properly أو صار فياته some sort of lapse in hygiene. Puppies with diarrhea are a common cause or a common source for infection for children. فمثلا puppy has a diarrhea, then the baby has or the child will have diarrhea. This is a common picture here. Human to human transmission occurs, but it's not very frequent. So مثلا واحد عنده diarrhea بالبيت ممكن يصيب حدا تاني, yes, but it's usually fecal-oral route is the main problem. Campylobacter jejuni is a major cause of diarrhea in the United States. It was recovered in about 4.6% of people with diarrhea, compared with 2.3 for Salmonella and 1% for Shigella. So it is more dominant than the two combined. So inflammation of the intestinal mucosa often occurs accompanied by blood and stools. It does have blood and stool. So there is a form of bloody diarrhea. Systemic infection bacteremia can occurs most in neonates or debilitated adults. Clinical findings. Uh, what happens here? So it's primarily, what is the picture is a watery, foul-smelling diarrhea, followed by bloody stools, fever, and severe abdominal pain. So does this picture differentiate مثلا تفرقها كثير عن dysentery? It's usually not يعني تفكر عليها مثلا تطلع عليها because there is fever, there is bloody diarrhea. Uh, uh, so systemic infections, most commonly bacteremia, are caused by more often by Campylobacter intestinalis. The symptoms of bacteremia, fever, and malaise are associated with no specific other physical findings. This is the most مثلا it's the most common cause of acute neuromuscular paralysis هو Guillain-Barré. This is the زي ما حكينا the gastrointestinal infection that is commonly associated with this condition. So just for it's a syndrome, autoimmune disease, formation of antibodies against this bacteria can cross-react with neurons and cause demyelination of these neurons. It's also associated with two other autoimmune diseases, reactive arthritis and Riter's syndrome. Lab diagnosis: if the patient has diarrhea, stool specimen is cultured on a blood agar. Blood contains antibiotics. Incubated at 42, very important. Microaerophilics, 5% oxygen, 10% CO2. This will favor the growth of Campylobacter. It is identified by failure to grow at 25, oxidase positivity, and sensitivity to nalidixic acid. Unlike Shigella and Salmonella, lactose fermentation is not used as a distinguishing feature for Campylobacter. Tamam. If bacterium is suspected, a blood culture can also be done. You will reveal the growth of this characteristically comma or S-shaped motile gram-negative broad. حكينا مين كانوا الاس-shaped هذول؟ ما هم عندنا Campylobacter، كان Helicobacter، الثانية والثالثة كانت Vibrio. Identification as مثلا intestinalis is confirmed. It's failure to grow at 42 because it will grow at 25. Campylobacter jejuni is the one that grows at 42. Treatment: erythromycin or ciprofloxacin. For this kind of enterocolitis, you have to give antimicrobials. For jejuni, erythromycin, ciprofloxacin. For intestinalis, you can give an aminoglycoside. Prevention: mafi vaccine. And then obviously you have to have proper food handling and hand washing to prevent this illness. I think this is where we stop for lecture 4, I think, of the gram-negative enterics. Next week will be the last lecture of gram-negative enterics, but then we'll talk about mycoplasma and TB the week following that. ويعطيكم العافية.